Dale Warford says he was born to ride. In fact, he's been riding a motorcycle for more than 40 years. And as risky as that might seem, it's nothing compared to the risks he was taking with his own health.
I was having shortness of breath and some chest pains, and my heart just seemed to be pumping a little faster than normal. Well, I was very scared because of the chest pains and the inability to breathe. Having been a smoker for 44 years, I figured I probably had something really bad.
Eventually, Dale ended up in the emergency room at Westside Regional Medical Center, where he was put under the care of Dr. David Kenigsberg, who diagnosed Dale with atrial fibrillation.
Atrial fibrillation is a very disorganized arrhythmia where the top chamber on the left is beating about 300 to 600 times a minute in a very disorganized fashion.
For Dale, the treatment of choice started with medication, but soon that wasn't enough to keep the condition under control. Dale then underwent a state-of-the-art procedure known as a complex atrial fibrillation ablation, where the part of the heart responsible for the irregular heartbeat is actually cauterized.
Atrial fibrillation comes from the left atrium, and the veins that come out of the left atrium are the triggers for atrial fibrillation. So when we burn in atrial fibrillation, what we're trying to do is create an anatomical barrier between where the firing occurs and the rest of the heart.
The procedure is performed at Westside's new electrophysiology lab. A small puncture is made in the patient's groin. Catheters are then placed in the patient's vein that work their way up to the heart chamber.
The guidance afforded to me by using electroanatomical mapping is very precise, and before I even start burning, I create a shell of the heart and the chambers that I'm going to be burning in. And so I know exactly where my catheter is at all time, real time, while it's moving. And that's a big improvement since we first started doing the procedure just with X-ray. And I'm happy to say that Westside has this advanced equipment that allows me to do that. The support that I've been given from HCA is excellent. Because HCA stood behind me and got me all the equipment, we now have state-of-the-art equipment that allows us to do cutting-edge, most complex ablative procedures here in South Florida and Plantation.
Once the catheters are strategically put in place, it's not long before the procedure is completed, and with incredible results for Dale.
When I went to sleep, I had looked at the machine next to me, the monitor, and it read 192, which was the beats per minute. When I woke up, about probably 40 minutes later, I looked at the machine that was 59. And I knew it was going to be better, so.
Heart sounds good. The best part is fixing problems. So patients come to me with an arrhythmia, they want it fixed, and I'm able at the end of the day to fix the problem. They don't take medicines, they feel better.
Which is exactly what happened in Dale's case.
He had no procedural complications, he feels well, and he's back to riding his Harley.
Yes, Dale is back on his Harley, but before leaving Westside Regional Medical Center, he stops just long enough to give his wife of 40 years, a nurse at the hospital, a kiss goodbye. Reporting on the Faces of HCA for the Healthcare News Network, I'm John Bafar.